Today I'm talking about acupuncture and labor preparation. I think acupuncture has so much to offer women who are approaching their due dates, and I want to explain a little bit about the details of what we're going to be doing in treatments. Now, I recommend most women start coming in for really regular treatment around 36 or 37 weeks of pregnancy. That's when most of my patients will start either once a week or twice a week treatments. And whether they're coming in for once a week or twice a week really depends on what their own circumstances are. Are they in a lot of discomfort? Are they up against a deadline in regards to, maybe their age and their OB or their midwife is recommending that they have an induction at 39 or 40 weeks, and we really want to see if we can get things going beforehand and or support an easier induction process should labor not start before kind of the pending due date, induction date. So there are a lot of different things that we can offer, but the primary thing that we're looking at for when women are coming in to prepare for labor is removing anything that might get in the way of labor progressing naturally on its own. So that could be a variety of different things. We look at, is there any muscle tension or structural issues that may be kind of impending labor or making it difficult for the baby to get into a proper position. So we look at muscle tightness. Is there any kind of torques, or are there any kind of torques in the pelvis? Is the sacrum really stuck and locked down? That's a big issue. Is the pelvic bowl really tight? What do we need to do to remove any structural issues that might be preventing the baby from really descending down into the birth canal in a way that will encourage the onset of labor? Acupuncture in general is very concerned with this idea of stagnation slowing things down. And that's a huge issue when it comes to labor starting on its own. So we're always going to, just from a really general perspective, remove stagnation. But honestly, sometimes that really does a lot for women, especially in the end of pregnancy when things can get a little bit intense and stressful. And that will encourage stagnation, kind of build up stagnation in the body. So we can always clear that out to help things move along on their own. The other thing I do a lot is really focus on the position of the baby and ensure the baby is in a proper or optimal fetal position. The reason that this is super important is that when the baby is head down and applying pressure on the cervix, then the cervix is more likely to dilate. It's that pressure from the baby's head that's actually encouraging the cervix to dilate. So if the baby isn't in proper position, you're not going to get the pressure on the cervix. You won't have that natural mechanism of encouraging labor to begin on its own. So position of the baby is a big deal, and we use acupressure, we use positions and exercises, posture, all kinds of different things to really support encouraging what we call optimal fetal position. The other thing is that we're looking at softening the cervix, and that's just a really traditional basic thing that acupuncture is fantastic for, and it's valuable for a couple of different reasons or in a couple of different circumstances. Number one, to a woman who's preparing for labor so that she can progress into labor naturally. But there are a lot of women, at least in my practice, because I guess I tend to see women who are a little bit older, like 35 and above, and maybe that's just kind of a lot of women are having babies later in life these days. But because of that, a lot of the local OBs and midwives are putting a lot of pressure on women to go into labor by either their due date or sometimes even the week before their due date, really depending on their age and specific circumstances. So if you're looking at a potential induction, then what we want to do is really make sure that everything's in line for that induction to go smoothly and easily. So that when you go into the hospital, your cervix dilates, you're progressing through labor, there are no stalls, all that sort of thing. So from an acupuncture standpoint, we're really focusing on getting the cervix ripened. And then, as I mentioned a little bit before, we're really helping the baby descend down into the birth canal. Again, acupuncture is brilliant for this. There are very specific points, many of which you probably know because you've had to avoid all of them with massages and even facials, but certainly with acupuncture during the majority of your pregnancy. Now you're past 37 weeks, your full term, we can really start using those specific points to our benefit. And many of them are about descending the baby down into the birth canal. Acupuncture is very concerned about direction, and we're helping the direction of energy move down so that the baby can move down. And again, we want the baby to be in proper position and start applying pressure by the top of its head on the cervix to encourage the cervix to dilate. Um, and then there are some occasions where we actually want to encourage contractions. I, that's not our go to when women come in for labor prep, but there are a number of different reasons why that might be appropriate. As I mentioned before, sometimes there are impending induction dates because usually related to age. Sometimes women are in a lot of pain and really want to get things moving so that they're not in such severe pain. But there are a whole number of different reasons why OBs and midwives will be recommending people to go into labor sooner rather than later once they're past 37 weeks anyway, for health-related reasons. So we can help get things started as long as the body is somewhat close to doing that on its own. And of course, we're always taking safety of the mom and safety of the baby into the utmost consideration. It's always our top priority. And then the last thing, although it's not really the last thing because there are a ton of things that acupuncture can help with in this stage of pregnancy for women, but an important thing is really keeping the mind calm and managing stress levels. Because as I mentioned, a lot of women, not only are women oftentimes trying to finishing up what they have to do to work so that they can finish work on a good note, but they're also scrambling to get things ready for the arrival of the baby. There may be added pressure from docs around, additional testing or pending inductions and all that sort of thing that really stir up a lot of stress and worry and anxiety in women in those last few weeks of pregnancy. And of course, that's the last time that anyone wants to be stressed out. So acupuncture can really be so supportive of women during that time in regards to stress, helping women sleep, get comfortable sleeping, and just manage stress levels overall. So those, I think, were my top 6, but to be honest with you, it's far more than that, and it can get very, very individualized, and it always is very individualized. So if you have any questions, please shoot me an email at bellacupuncture@gmail.com or call the office. But I'm always happy to talk to people about how acupuncture can help them given their specific circumstances at the end of your pregnancy. So hope that was helpful for today.